Hi, my name is Richard Dobson. I'm a Professor of Health Informatics based here at King's, and I'm the head of the Department of Biostatistics and Health Informatics, and we undertake a large amount of research that utilises data, different types of data, in order to try to improve care. We're based within King's Health Partners. So King's Health Partners is an academic health science centre, one of only 8 within the UK. And this involves a special relationship essentially between the university, King's College London, and the hospital partners that are part of King's Health Partners. So this project is taking advantage of the fact that we collect huge amounts of data within the NHS constantly, 24/7. You know, when you go and see a doctor or see a care team, go to the hospital, you know that much of the time spent when you're engaging with the team is them typing information in. Now, gradually over time, that accumulates to be a huge amount of information. Now, often that information isn't really exploited or utilised. It just sits there. It's kind of one-way traffic, if you like. So what we're trying to do with this project, and what we've been doing, is building systems that actually surface that information, take it out of those hospital systems or make it available, and then people can start to derive insights from that and provide new learnings, new knowledge. We can turn this data into knowledge and then turn that knowledge into action that improves the care of the individuals that it was taken from. And we've seen these large language models start to appear that have lots of emergent capabilities and behaviours. We've all used ChatGPT, which is trained to be able to interact with you and chat with you. But we can, those kind of GPT models, if you like, have been trained on lots of information that's on the internet. And they've seen very little data that relates to real care, real clinical scenarios, real world practical care. And then we want to train or tune the models to develop specialist behaviours in certain areas, such as organising or understanding or being able to predict what might happen next for a patient, or predict what the best treatment might be for a particular patient, or predict which patient might respond better to a certain medication. The kind of large language models that we've trained so far today, we've trained on over 15 years worth of data, huge number of people from South East London, a very diverse population. And this GPT model has been trained to understand 190,000 different medical concepts. So that's whether that's diseases, symptoms, procedures, or medications. And so you can say to it, I have a patient here that has, is a certain age, at a certain age developed a certain disease, and then a bit later develop something else. So you can create this history and give it to the model and say, now tell me what's going to happen to this person, and it'll make a suggestion. But what we want to do in this particular project is make it a specialist in certain areas. We want to do this in a way that's safe and sets a precedent for future work. So there's a lot of concern about how we develop and apply and use AI within the healthcare system. So we want to set a precedent for how AI is used safely. And we're already working within the centre with some of the regulators within the UK around our existing models, and investigating the bias within those models, and kind of mitigating that. In terms of the patient benefit, we want to see people identified or diagnosed at an earlier point. And we want to understand as early as we can what is likely to be the course, the disease course or disorder course for their condition, because then we can provide the more tailored care, more appropriate care, the right medication for them, the right kind of support for them and their families. And therefore it's going to make that whole kind of drug development process much better, much safer. Motor neurone disease is a great example of a condition that we'll be able to focus on here. Classically, rare, but actually we're fortunate enough to be working with hospitals that are major centres of motor neurone disease care. And we have this data that's been collected over a very long period of time. So, close to 20 years in some cases. So we have this kind of extremely long amount of information, detailed information on each person. We also have multimodal data as well. So other type of types of data. Some of our centres have been collecting genetic data on these kind of patients over a number of years. This includes kind of sequencing of the whole genome. So this provides, different layers of information. So combining the electronic health record information with genetic markers that have been identified allows us to provide a much more kind of 360-degree view of the patient through these different kind of data layers that we're able to overlay. And so we'll be able to understand the kind of the various kind of patterns of disease and disease progression in people that have this kind of developed this terrifically horrific, disease. And understand how those change over time. We want to shift away from just treating everybody the same when they have motor neuron disease, to actually giving treatment that's more specific and tailored to them and their needs and what's likely to be the future for them and their progression of this disease.